The COVID-19 pandemic has positive and negative impacts on different aspects of lifestyle behaviors. Negative lifestyle behaviors are associated with an increased risk of adverse outcomes from COVID-19. While dealing with COVID, we overlooked the fact that people's lifestyles were severely disrupted. Many people have become physically inactive and developed irregular eating patterns, which leads to unhealthier lifestyles and aggravation of lifestyle-related diseases. COVID-19 pandemic has also caused significant changes to homes, working life and stress. A multi-sectoral approach promoting healthier diets and increasing physical activity can help in slowing down the diabetic epidemic and heart diseases. Be it diabetes, myths and facts will impact and help a large number of people to prevent or control metabolic disorders. Today we have with us experts to share with you advice on leading a healthy life. Let me introduce the guest to you. We have Dr. Y. Sekhar, diabetologist, Bangalore, Dr. C.H. Manoj Kumar, consultant physician, Manipal Hospitals, Vijayawada, and Dr. Anil Saxena, Executive Director, Cardiology, Fortis Hospital, New Delhi. Thank you so much, doctors, for joining us on this very critical issue. Starting with you, Dr. Sekhar, do medicines that are used to treat viral infection cause hyperglycemia or high blood sugar? And if yes, then after getting cured of the infection, do blood sugar levels come back to normal or do they need medication to reduce them?
SARS-CoV-2 infects the pancreas through the ACE2 receptors, which are present in the pancreas. So this can cause pancreatic damage and with impairment of insulin secretion, thereby causing hyperglycemia even in non-diabetic patients. Now, there are three scenarios that are possible when it comes to viral infection, especially SARS. What happens is either the person has high blood sugars or diabetes, but is not aware of it or has not yet been diagnosed. The patient may have pre-diabetes, and this acute inflammation that happens because of the viral infection may have triggered him and put him into a situation where his blood sugars are very high and may have finally developed diabetes. And the person may have been greatly at risk, whether it comes to genetic factors or being overweight or sedentary lifestyle. So all these things do contribute to increase in the blood sugar levels, which has been noticed especially in SARS-CoV-2. And the other thing is the usage of steroids. The usage of steroids in COVID-19, we have been using it a lot, but this is also one reason why we have noticed an increase in the blood sugar levels post-COVID also. Now, post-COVID, what should an individual do is that they should monitor their blood sugars frequently and exercise regularly so that the intensive glucose control is there, and it is what is most mandated. So if the person is sent home on steroids, what they should do is they should keep checking the blood sugars even at home, and then they should report to the doctor as and when required.
Okay, so we really need to take care and monitor the levels. I think that's key. Dr. Kumar, we have learned many things due to the pandemic. The importance of immunity is of course one of them. How does immunity vary in people with diabetes?
Actually, in the diabetes, we know certain complications like cardiovascular disease, renal disease, and stroke and all this. In such a way, immunity dysfunction is also one of the important risk factors for uncontrolled diabetes mellitus. So whenever there is a immune system is little less in diabetic patients, there is every chance all these diabetic patients are more prone to get some of the infections like pneumonia, tuberculosis, and or urinary tract infections, skin infections. And one of the major infection in a diabetic patient is the foot infections, which is one of the leading cause of amputation in Indian setup as well as worldwide. So not only this, because of lack of immunity, diabetic patients are more prone to get COVID in this pandemic. And the COVID and pandemic, in the COVID pandemic, diabetes and COVID positivity is one of the risk factor for death, what we had seen in the recent past. So whatever inflammatory cells, which is the immune system contains for the defense of our body, and the products which are released for the control of the infection, the function is decreased. So this is most important complication in diabetes, which lead to increased risk of infections, and there is increased chances of mortality. So very good diabetic control will definitely, there is a lot of reduction in mortality and morbidity in a diabetic patients.
Great. Okay. So that we've understood that connection. Dr. Saxena, COVID-19 infection and cardiovascular diseases seem to have a bidirectional relationship. How exactly do they relate? Can you just tell us that?
Yeah, so you are absolutely right that they have a bidirectional relationship. This means that on one hand, the COVID-19 illness can cause involvement of heart, by causing a condition called myocarditis or inflammation of the heart muscle, which can subsequently progress to heart failure. On the other hand, there are a lot of arrhythmias which can be caused because of involvement of heart in COVID-19 illness. So we have seen that patients, even after months and weeks and months after the illness, they have rhythm disturbances. Some patients have slow heart rhythm, some have fast heart rhythm. So a lot of cardiac problems can occur because of COVID-19 illness. But in the same way, in the other direction, patients who have cardiac disease can have a more severe illness if they acquire COVID-19 infection. You may recall that patients who had cardiac disease or some other comorbidities, they were given preference in vaccination over healthy individuals in the 45 to 60 year bracket. And this is because the risk of getting a severe illness is more in patients who have a cardiac illness or some other comorbidities.
Okay, so that's I think a very important point, and you're absolutely right. Yes, we need to take care of that as well. Dr. Sekhar, working from home is convenient, but people are working more than regular working hours. They are neglecting medications due to work stress. What should a person with diabetes know about adherence to medications during this pandemic?
See, I was very happy when I heard about this concept of work from home. Unfortunately, being doctors, we don't get this thing of luxury, I should say, working from home. This is what was my thought process initially. And I was used to make fun also saying that I'm also looking for a job where I can get an opportunity to work from home. But slowly things have changed. Slowly we have also started realizing, now work from home is not so easy. What has done is it has added to working hours. So a individual used to go for work at say 9 o'clock in the morning, come back at 5, 6 in the evening. But that doesn't happen when you are at home. So you are glued to your system or your work desk throughout the day, almost working for long hours. And this has contributed to reduced physical activity and also caused a lot of weight gain. Now, what should a person with diabetes do in such a scenario is they should make it a point that they should give more time to self-care, see that they do some regular physical activity, do not miss those activities, take care of their diets. They should be counseled well about monitoring of blood sugars, especially the self-monitoring of plasma glucose, which can be easily done at home with a glucometer. They should also be counseled about achieving glycemic goals so that the blood sugars do not shoot too high, and they should also be told to adopt a healthy lifestyle. So these are certain things that they should keep in mind, and this will help them to achieve better glycemic control.
So managing lifestyle obviously is important. Physical exercise and reducing stress and self-care is key. Dr. Kumar, there is a belief in common people that diabetes only affects people with obesity. Is it true? What are the other risk factors?
See, 85% of diabetic patients are obese. So obesity is one of the risk factors for diabetes. So nowadays, obesity is also an increasing global problem as well as diabetes. So most of the time when these two conditions combine, this is called diabesity, which definitely increases the risk of cardiovascular disease, your stroke and all these complications. So diabesity is the latest trend, what is going on. So obese patients are more prone for diabetes. And some even in Indian patients, obesity doesn't mean everybody looking fat, but central obesity, especially abdomen obesity, the large tummy, they are more prone to get diabetes. So when a patient is obese, a 5% reduction in the weight also decrease the risk of diabetes. So not all obese patients will get diabetes. The other risk factors also are very important, like a patient having hypertension or patient having family history of diabetes, patient has physical inactivity, patient is taking certain drugs which increase the blood sugar levels like a steroid, and certain genetic problems in family history. And ethnicity, some groups of people are more prone for getting diabetes, especially South Asian Indians are more prone for diabetes. They get diabetes earlier than compared to any other country. So obesity, apart from obesity, if a patient have other risk factors also, they are more prone to get diabetes.
So there is definitely a connect and we need to take care of that. So on this note, we're going to be taking a break. We'll be back very soon. Welcome back. You're watching Beat Diabetes. Dr. Saxena, the lockdown has disrupted routine of people. People have missed routine blood tests and also other health-related tests. Can you please advise our viewers, patients, which tests should people do regularly to keep a check on their heart health?
So we had a lockdown for a significant length of time. So many patients could not get their medical treatment due to restrictions on travel. Sometimes it was imposed due to lockdown, but it was also sometimes self-imposed because of fear of travel. And many people are still working from home and they're attending classes from home. So as Dr. Sekhar pointed out, the problem is further compounded by lack of physical activity or exercise. And social isolation is also not good for health. So my view is that unless there is a fresh lockdown, people can now safely access medical facilities to get investigations done and also to get treatment. So there should not be a fear of visiting hospitals. The hospitals that I know, most of the hospitals are now almost like having normalized functioning. But teleconsultations have been a big help in last 18 months. So if one is afraid of visiting a hospital, one can consult a doctor online, get blood sugar and other investigations and ECG, etc. than at home. And they should control their blood sugar very diligently, even if it is done from home.
Okay, yeah, so they can consult the doctor and go ahead. Dr. Sekhar, many people believe that low birth weight is strongly linked to type 2 diabetes risk in adulthood. How does low birth weight affect the risk of developing type 2 diabetes mellitus?
This may be a compensatory adaptation to an adverse intrauterine environment during the fetal development stage. So the small fetus and the structural and functional change that happens in the important organs lead to insulin resistance and abnormal islet development, which could cause diabetes in adults. So the lack of nutrients may have a permanent influence on the fetal metabolism, increasing the risk of obesity and type 2 diabetes in adults. So low birth weight has also been found to be associated with increased leptin levels. Now, leptin is a hormone that helps to inhibit hunger and adequate energy and regulate the energy balance in the body. So this can lead to increased rate of obesity, insulin resistance, and type 2 diabetes. So these are components of the metabolic syndrome. It has also been noticed that people who are born with low birth weight, they have more visceral distribution of obesity and significantly reduced muscle mass. So, and there is also an increase in body fat content. So all these things contribute to the development of type 2 diabetes in adults.
Okay, so since we've understood that connect between low birth weight and diabetes, Dr. Kumar, are gestational diabetes and preeclampsia related? I mean, do preeclampsia or gestational hypertension increase the risk of postpartum type 2 diabetes mellitus?
Yeah, when we talk about gestational diabetes mellitus, any patient who is pregnant develops sugar during pregnancy. We call this gestational diabetes mellitus. So gestational diabetes mellitus will definitely increase the risk of preeclamptic toxemia and eclampsia. So this is in a patient having diabetes and also having increased blood sugar, blood pressure, and protein in the urine and pedal edema, all these factors. And sometimes they even develop fits. This is called preeclampsia and eclampsia toxemia, PET. So PET and gestational diabetes combination is not good for any pregnancy. This will increase the mortality and morbidity in a pregnant woman. So not only this, all these patients, especially PET and diabetes, because this is related through one of the mechanism like insulin resistance. Subsequently, after delivery, they may develop diabetes. Some patients will continue to have the sugars level even after post-delivery, but some patients after delivery the sugars will be normal, but within 5 years they develop type 2 diabetes. So all the pregnant women should be screened for diabetes at least after 6 to 12 weeks after delivery, whether they are having the same sugars continued or their sugars are normal and subsequently they develop. So this is a OGTT test, 75 grams we do, especially 6 to 12 weeks to see whether these people develop type 2 diabetes.
Okay, so I think rechecking it is very, very critical. Dr. Saxena, tell us, how does the long-term cardiovascular risk of patients with type 2 diabetes mellitus compare to non-diabetic patients with first myocardial infarction?
Yeah, so that's a very important question and also an interesting one as well, because presence of diabetes can sometimes have paradoxical influences on the eventual outcome. So it's very well known that diabetes is a risk factor for development of coronary disease, and diabetics have much more serious coronary disease as compared to the non-diabetics. Their outcomes are also worse because even after successful treatment of cardiac illness, they can have progression of coronary disease. On the other hand, majority of diabetics have mild illness or moderate illness. So being a diabetic, they are aware of the risk. And because of this, many of them visit their doctors quite often, get their treatment done they take their health much more, they more diligently. They get the investigations done very regularly. And in general, there is a closer medical supervision in diabetics as compared to non-diabetics. And that way they benefit from a early detection of coronary disease. So my message to all the diabetic persons will be that they should get investigated very regularly. And besides controlling the diabetes, they should look after their target organs which are affected in diabetes, particularly the heart, eyes, and kidneys.
Yeah, so I think
they should keep a watch on these particular organs.
Yeah, definitely. I think that's a very important message which you've given. Dr. Sekhar, just a last question. How does the prevalence of type 2 diabetes mellitus differ among racial and ethnic groups?
The prevalence of diabetes varies widely among various racial and ethnic groups. Type 2 diabetes is more prevalent in certain populations of the world. Like you look at the Hispanics or the Native Americans, the African Americans and the Asians. Talking about our country per se, we are known to be the diabetic capital of the world, and our aim is to turn it into the diabetic care capital of the world. So type 2 diabetes has been found to be common in countries where the diet contains more calories. So more the number of calories that we consume, the more the chances of developing diabetes. And as people adapt to Western lifestyles, people are not worried about weight gain. Type 2 diabetes is virtually becoming an epidemic in such countries. And population aging is one reason that type 2 diabetes is becoming common. In addition to increasing the number of cases that we see in adolescents and young adults. So the prognosis for diabetes mellitus will definitely be better with intensive therapy, so thereby causing reduction in the number of micro and macrovascular complications that are associated with diabetes.
So I think that's something really, we've really understood a lot today, how we need to take care of diabetes, early diagnosis, screening, and also changes in our lifestyle. Thank you so much, Dr. Sekhar, Dr. Kumar, and Dr. Saxena for joining us today.